in various different camps. And tonight we've got a very special guest, a young lady that was actually introduced to us by Dave Tollerfield. And she comes very highly praised by David. And of course, as you know, he's a most discerning chap. And for those of you who don't know David Tollerfield, I'm absolutely shocked, because if you haven't got about 6 books by David on your bookshelf, then why? You know, because he's written books about just about everything over the years. And he's still writing them even 6, 7 years after retiring. His company that he writes with is called The Busy Pencil Case, and it's quite right. It's a very busy pencil case indeed. Anyway, the young lady that we have with us tonight is called Afni Hamilton. Now, as I say, after David had introduced us, she very kindly started to write some pieces for the Institute's house journal, which is Podiatry Review, as I'm sure most of you will know. Certainly, if you're a member of the Institute, then you will get your quarterly Podiatry Review come through every quarter, as you might expect. If you're not a member of the Institute, then you can subscribe to it, or if you're a student, there's various packages that you can have to get a copy. And it's always full of, well, we hope it's always full of interesting stuff. And it's a very good source of CPD as well. You know, a good evening's read or even a good week's read, come to that. Well, the edition that I've got here that came out a short while ago is a January, February, March edition. As I say, it's quarterly. And I hope that those of you who have received it have actually read the piece that's been put together by Afni. Now, of course, there's Afni, about the author. And as you can see, a very experienced person indeed in our profession. So Afni runs Tiptoe Foot Care, which is very appropriate. I do like that, Tiptoe Foot Care, that's good. She's got a private podiatry practice in Barnet in Hertfordshire. And I didn't realize actually until I read about you being in Barnet, I actually went to Herts University to do some of my CPD training in skin and skin surgery, which is interesting. So it probably wasn't very far away from your place. She graduated from University College in London, and then she went on to do her master's at King's College. As I say, she is in private practice at the moment, but she has paid her shilling to the NHS, as most of us have at some time. And I believe you were in Southwark doing your NHS work. Excellent. But now she does her private work as well. She also is involved quite deeply with Macmillan Cancer Care on the Allied Health Professional boards and that they have there. So I hope that she'll perhaps tell us a little bit about that. But obviously she can tell you far more than I can. So I've waffled on enough. So Afni, welcome. You are most welcome to our webinar. And if you could unmute yourself, then you could actually talk to us. Can you unmute yourself?
There we go. Yeah, it's gonna. Can you hear me now, everyone?
I can hear you and I can see you.
Excellent. Welcome. Thank you all for joining the webinar. I'm just going to share my slides with you, so just bear with me a second. And go.
While Afni's doing that, can I just point out that if you have any questions for Afni as we go through, then the chat box is active and the chat is being monitored both by Jill and also by Kirsty, who are our backroom ladies who do all the wonderful things at the back of this to, you know, to make it work smoothly. So if you have a question that you'd like to put to Afni, then if we can, we'll put the question as we go through. If it's something that needs a more detailed response, then perhaps if you make sure that you send the question in via the chat box, if we can't get around to you, then I'm sure that Afni will be able to give you an answer in the course of time, and we can send you one from head office if necessary. Okay, so thank you. Over to you again, Afni.
Brilliant. Thanks, Martin. Actually, I live pretty much 10 minutes away from Hertfordshire University, so it's quite appropriate where I am. So yes, so I'm going to be talking about anxiety and podiatry. One of the things that I'll tell you a bit more about my clinic and how it works, so that I think that'll give you a bit more perspective about what I do. So I've been a podiatrist for over 15 years, but I also specialise in pain management and movement therapy. So I'm going to be talking a bit about both and how I see anxiety working in my clinic and what happens. So why am I talking about anxiety today? So I think, first of all, we need to address what do we exactly mean by anxiety, so we're all sitting on the same page. In my view of anxiety, it's quite a multifaceted group of stresses or tensions that people are getting experience in life. So I suppose what you could call anything that involves life stress. And I think all of us in our environments today know there's a variety of different places where we have and we experience anxiety and stress, particularly during these COVID times. You know, people at home working, homeschooling, going to the clinics, you know, having patients quite traumatized coming into the clinic and things. So you're starting to see a lot more anxiety in your patients, particularly. And also to note that there's also different aspects of anxiety. So it might be in a particular situation you're in that you get the anxiety happening. So whether it's public speaking or, you know, going to certain places, you know, that familiar smells, things like that will send you back to that place of anxiety as well. So I think it's important to put it into context, you know, where you're finding the anxiety, what type of anxiety it is, and also unpicking what exactly is the anxiety, whether it's more to do with hopelessness, whether it's frustration or anger. Often there's underneath emotional issues that are bubbling up that create this anxiety in our patients. In my clinic, my main belief is that during assessment and treatment, I always assess anxiety because I think it's a vital part of the holistic treatment plan that I do for anyone, especially because in my pain management clinic, I'm treating the whole body, not just the foot or lower limb. And also, I think sometimes we all forget, and even I do sometimes in practice, you know, when we're so focused on the foot, we forget that it's attached to a human being at the other end. So being always aware that there are things going on in the background for them. So I'm going to be looking at 2 case studies, and throughout the presentation, it'll show you how and what I do for each of these case studies. I'm going to give you a physical case story where patients come into my clinic with pain in their shoulder from a car crash injury. And so when they've come into my clinic, it's tended to be, they've come to me after they've seen multiple people. So they've seen the osteopath or physios or whoever, orthopedics, and there's still this unexplained pain going on. And so I will be looking at the impact of what I see and then talking you through it. And I think for us, particularly in the podiatry world, just a mental health story. So I think we're all at the moment, particularly during COVID, we're seeing patients who've had bereavement or loneliness or depression and seeing how those manifest. And they're traditionally seen as mental health issues in isolation, but how they can then impact physical symptoms. So we're going to be looking at those too. So in my role in my clinic, I tend to assess, identify, and detect these symptoms and find out what these causal issues could be and then diagnose the treatment around it. And in there, I'll include everything that I need to know about the patient. So my expertise is joining up the dots to understand the links between these symptoms that might seem to someone else random, but to me, they all make sense and I can connect them up. And I'll be looking at things like diet, brain capacity. So in terms of brain capacity, it's, you know, concentration, brain fog that we all hear about now recently, the emotional well-being, any traumas, anything that's going on. Often remember, when we have trauma or emotion, you know, we always hear the saying, oh, I feel it like in the pits of my stomach, is always one of those kind of sayings that we have. And for us, that can, we know that emotion affects the digestive system. So in terms of nutrition being absorbed through our well-being, all sorts, also the depletion of certain nutrients like zinc and magnesium. Because when we get into this anxiety state, we get this fight and flight reaction. And what happens is when we're in that fighting reaction, our body diverts all its energy from digestion to, you know, dealing with the situation. So if you imagine we're all in heightened anxiety states, that will then have a nutritional impact on us, but also an emotional in terms of the neurotransmitters and brain chemicals going on in the brain. So the concentration span and things, and just being able to focus. So it's always important to look at everyone in that detail. And then I'll be making diagnosis and then tell you how I do my treatments. So in terms, sorry, terms of patients with pain in their shoulder, what I'll be looking at, sorry, just bear with me a second. I'm just going to.
That's what usually happens to me.
Sorry, I wasn't expecting my landline to go off, which never seems to go off till then. And it's quite distracting when you're trying to talk about pain.
Yeah, my landline only ever goes off once in a blue moon. And
well, that's it, the one time during the presentation. So, yeah, apologies for that. Not the most, mobile phones were off, but not landlines.
Yep. Can I just jump in there, Afni?
Yeah.
Because there's one, this fascinates me. Now you're mentioning these things that really some of it does step out with the scope of podiatry.
Yes.
How are these people coming to you? Are they coming for a podiatry purpose and then?
No. So in terms of the pain in the shoulder, they're coming to me in my pain management clinic. So they are coming in specifically, which is why I wanted to show you how, while I started out as a podiatrist, my expertise has grown. And I do a whole range of other therapies, and I do pain management. So I actually often, I see a few pre-Olympian athletes and stuff where they've had pain issues, as well as patients who've had back surgery and things like that, or TMJ, which is the jaw problems in the mouth, clicky jaws, things like that. So that's coming out from my pain side of things. But equally, it's a bit like, when you pull on a piece of string, it unravels. And so I start unpicking everything, and I then use those as well in my podiatry clinic. So while I'm not expecting you to treat the pain in the shoulder, if I show you how I treat it, you can use some of those tools to possibly, incorporate in your clinic, or know where to refer to. Because often, podiatrists are great at signposting people to the relevant specialists.
And that's often under-recognized, isn't it?
Exactly. And so I think we'll expand on it. But in terms of our assessment, we're great. We have 30 minutes or 20 to 30 minutes with our patient. And often, particularly in private practice and sometimes in the NHS, you'll be seeing that patient multiple times. So you build up this rapport. So you can build up small changes in their behaviour, or the way they tell you things, or they open up and they tell you a lot more about their story that you hadn't realised. So you build up this rapport, and that gives you a whole range of other skills that you can then use to signpost them. But also, I think sometimes we're one of the only very few professions that not only know medical side of things in terms of medicines and skin and nails, but we also know the musculoskeletal, and we can link the two together, which I don't think very many professions do. I mean, even if you look at doctors, if you look at orthopedics, they know how to, the muscles and how they work, but they don't know what the skin implications could be of that, So it's the two together. And physio, again, will look at the muscle side and nerve innervation, but will they be looking at the skin and the changes? And I mean, coming to my cancer side of things, I think that's why we're so well placed where we are, for helping patients on anti-cancer therapies like chemo and radiotherapy. And you could use this pain in the shoulder example for one of my breast cancer patients easily. They'll come in with pain in the shoulder. Often they've had breast surgery, so they've had scar tissue. They're using the loss of range of motion in the shoulder. That will create a whole range of other issues. We know in our gait cycle, we're the only animal to use cross-body patterns. If you haven't got your swinging arm going in your gait cycle, that will have knock-on effect on your spine, on your hips, on your knees. And you can see how all these things will then fall down to the foot and lower limb. And so you can already pick up a picture about how these patients and how this pain is going to manifest. So I think we're really underutilized. I see patients from all over the world coming in to see me, and all over the country. So, and it is particularly for the stuff I do in terms of pain management. But equally, I do still see podiatry, because I always think it's important that you stay grounded, because you will be seeing those podiatry patients and you will be able to identify things. They will come in and say, actually, I'm having a really rubbish time. I just can't get out. I'm getting this pain here. What can I do? And you might say, well, actually, maybe you need to see an osteopath or chiropractor or a pain management specialist, or, there's a whole range of things we can look at. So in terms of this kind of assessment, so if I go through with the pain in the shoulder, maybe I'll change it to, instead of a car accident, let's go for the breast cancer patient, because I think that will give you a bigger understanding. So we know that with this pain in the shoulder, there's going to be an impact on their mobility. With that will lead to emotional issues with that impact of mobility, because they're probably going through treatment or post-treatment. They're getting frustrated that they can't do the things they used to be able to do. They're thinking, when can this end? You can see this emotional, complex picture coming out on this patient about what's going on. And also they're in pain. Pain, you know, on the brain takes up 60% of our focus when you're in pain. And we see it, you know, when we see it in the foot, when people are in pain, their whole posture changes, their whole demeanor changes. So we know that this can be applied to both. So you'll be looking at the mobility and looking at that emotional. Obviously, with the emotional side, if they are in frustration, they're getting anger, you know, they're physically getting tired because they can't move the area. All this starts to bubble up, and you can look at, you know, will that impact the digestive system? Will that allow them to be able to have the nutrients they need? What about their mental health? You know, will they then want to be motivated to do any more exercise to help strengthen it? They might have, so in my case, a lot of them will have gone to different therapists before they've come to see me. Often I'm that kind of last port of call. And so you can imagine they're already disillusioned coming into my clinic and going, you know, I've tried everything. What's the point? Why should I be doing this? You know, you can, that's also an emotional psyche that you need to tap into. And so I will use a combination of therapies to identify what's going on emotionally. So one of the things I'm trained in is systematic kinesiology, which is muscle testing. And so we test the muscles and the body responds to different commands. And the muscles, you'll isolate a particular muscle and it will respond, and you can ask it questions. You can place different nutrients on there. You can look at the emotional side, and there's different finger modes that we use to find out what emotion there is that's coming up. So I often use that for the emotional side. And also, I also use the systematic kinesiology to know whether or not they're ready to talk about that emotion, because that's also important. If the patient's not ready to address the emotional side, you can't force it on them. It has to be, you have to be part of their journey, and they have to allow you in. And we also use bark therapy, bark remedies. So one of them you might have heard of is always publicised, you know, the rescue remedies for stress that everyone uses. You could easily use that in your clinic for patients, you know, even without any of the training that I've had. You know, if they're coming in with some kind of stress, go, well, have you your sleeping issues or anything, or during this COVID situation, have you tried the bark's, you know, rescue remedy? It does work. It is brilliant. The bark remedies, there's actually 38 different flower essences. And there's a couple of other similar type to bark remedies. There's bush remedies from the Australian bush flowers. You've got a whole range of other ones. But in my role, especially with the systematic kinesiology, I tend not to ask the patient the emotion sometimes, and because they don't know how to describe it. And the remedy, depending on what shows up, will show up, and then I'll tell them what the remedy is. And then they then start to open up that way. So that's also really useful. I also use fascial release. So what I find is often there's trigger points in the area, and sometimes that can initiate emotional responses. So say we're working on scar tissue and breaking down scar tissue, sometimes touching the area for that patient can actually bring up a whole range of emotion. It sends them back into that state of whether it was cancer treatment, or when they had the car accident, or when they've had a particular operation. It can really, you know, touch is really, really key, I think. A bit like smell, you know, when you're touched by someone, it does put you back into that emotional state. And so I'll use that. I also use something called anatomy in motion. So that will be more the physical side of looking at what's restricted and why. And so it's basically founded by Gary Ward, and he founded Anatomy in Motion. And I was really blessed and really lucky that I'd had personal training and one-to-one with him and his second in command, who Chris. And I really got to understand the anatomy in motion side of things. And it looks at each individual joint and what it does at what point in the gait cycle. It's quite intricate, but that also helps me just pinpoint what's going on with that shoulder, and if there is restrictions further up. So often there could be a restriction in the hip because of the cross body pattern, could be a restriction in the neck. But also, I don't think people realise, in the foot, the fifth ray actually has a positive correlation to shoulder pain. So looking at fifth ray movement in the foot will actually correspond with shoulder pain, and the metatarsals actually represent rib cages. And if you look at reflexology, which I'm trained in as well, those organs and everything around there will also correlate with findings that I find in the body. So I also use a bit of reflexology. So a number of different things. Acupuncture as well is another one, you know, for muscles. Acupressure as well will also be used. So that kind of shows the kind of the things I do with the patient at looking at what's going on. And then for your mental health case, you know, patients come in with bereavement or loneliness, and you might be picking up there's something not quite right with them, and asking them, you know, well, what's going on? You know, why is that? What's been happening over the last few months? Also, we're really good at listening to our patients, and sometimes they just need a listening ear to tell you what's going on. And I also sometimes find, so I repeat back sometimes really subtly and do it not in an intrusive probing where I go, well, how does this make you feel? You know, how's your diet going? Are you managing to eat well? You know, are you doing any exercise to help? And, you know, loneliness and bereavement, people either overeat or eat the wrong foods or not eat at all because they think, well, what's the point? You know, they've lost their loved ones. So looking at that kind of mental health issue side of things, you know, because it's impacting their life basically. So looking at those two and getting that in your assessment is quite important. And then, so in terms of the diagnosis side, so following the assessment, I'll write it all in, and I do lots of drawing, you know, of the structure and put all around the body. I'll draw out and then write all my notes around it as well. Through the systematic kinesiology, I identify obviously the emotional pain that's going on. In podiatry, you'll as we're sitting doing their feet, you'll be looking at listening to what the problem is, letting them let it out if they're crying about it. I have to say, when I'm doing assessments and treatments, so I had a patient in today actually with a back problem. He'd seen a number of people would come to see me, and in his last session he said he'd started crying because we were touching the back pain, and actually it was all related to he'd had some issues at work that had really traumatized him. And he'd said when he came in this time, he goes, after you've done all the emotional work, everything just felt freer. And he rang his mum and he said, I can't believe she made me cry in the treatment. But equally, he said it felt really cathartic, and he felt like he had a different perspective of the issues that were going on that had been impacting his life. And he said, you know, it was the first time he felt like indifference to the situation, was able to move on. So you can see how the back issue, he was holding that tension up in the back, letting that emotional release just allowed him to breathe more freely. We know the diaphragm and the abdominals work together, so allowing that to move will allow the pelvis to move, will allow the back to move. So you can see how already you're picking up a more complex picture on these patients. Always repeat back the problem to the patient, you know, see what it is, identify it. If let's say the emotion for, say, your bereavement patient is they're not eating well, there could be like anemias involved as well. Also, we know if they're not eating well, things like magnesium, they won't be taking enough magnesium and zinc, which are also used to help B vitamins. They're all used to calm the nervous system down, which we know with anxiety is always heightened. So there's lots going on with that. You know, and also I don't just stop my assessment. So I don't think of my assessment, right, I've done my assessment, now I'm going to do treatment. I'm always assessing as I go along. Always be really reflective, I suppose, in your practice. So whenever you're doing anything, always ask why am I doing this? And I think that is the key to finding out what's causing it and how to treat them to the best of your ability. And also you don't have to bombard them with loads of treatment options. So I've obviously whistled through some of the different treatment therapies I use. I don't tell them all the options. I get it all in, and then I just give them a couple and go, well, do you want help with the X, Y, or Z? You know, how do you feel about it? So getting them to be an equal partnership in the relationship when you're treating as well, I think is really important, rather than just being the practitioner telling you, and actually that might not be the path they want to go down.
Could I just dash in there, if I may? Probably like many people who are listening, I will be familiar with the term kinesiology, the term, but not actually what it is.
Right. you want me to give you a quick synopsis?
Have you got a potted description that's suitable for a
Right.
brain dead person like me?
Right, so kinesiology works on muscle testing. So let's say we will, let me give you a muscle to isolate. So we could isolate the psoas muscle. And in kinesiology, we believe there are 4 different realms that the body lives in. So it lives in the structural realm, which is, your physical posture, structure, muscles, activating nerves. It lives in the nutritional realm, which is all your digestive system, the emotion, nutrition that you might be deficit in or have over too much in. And then it lives in the emotional realm because there are underlying emotional issues with any kind of problem that we see. And then it lives in the electrical realm. The electrical realm is actually your meridians. And kinesiology was founded by a number of different practitioners who came together. So it was actually founded by osteopaths, chiropractors. There was a couple of bits from a podiatrist as well. So one of the techniques I use is called injury recall. And that was actually developed by an American podiatrist. Can't remember to hand what his name was. But it's the injury recall technique. And if you Google it, it tells you a lot more about it. And all these different things we will be testing for. So when we say we test the psoas muscle, so I'll be checking for the structural strength of it, whether it weakens, whether it's known as hypertonic. So what that means is it can't relax and it can't switch on and off. And if it can't switch on and off, it's actually classed as a weak muscle. So we also look at whether we'll use finger modes. So we'll have all different finger modes that we use to find out whether there's a structural issue to that particular muscle, whether there's a nutritional issue, whether there's an emotional issue. And then within those, there's even more branches that you'll be testing for. So you'll be touching different points and the body knows what those points are and what to do with it. So it's actually quite fascinating. It's starting to come out more in the medical term fields as well. A lot more people are using muscle testing. So you might have heard of neurokinetic therapy, so which is known as NKT. A few other therapists are using muscle testing in other variety of different ways of treating. So, but kinesiology is basically you can get hold of a muscle, you can test it, and if you know the right different finger modes or different points, you can access, you can basically read the body, and the body tells you what it needs to tell you. And I suppose that gives you a bit more of an idea. Does that help, Martin?
It helps enormously. Could I just clarify what a finger mode is?
Okay, so finger mode is, so I'll give you one of them. So a finger mode for when I'm testing for structural is this mode I'll be testing. So I'll put my fingers together and then test the muscle and it will tell me what's going on. But it's not just doing this mode. It's one of the different modes. There'll be other things I will do.
Fascinating. Thank you.
So yeah, so that gives you an idea. So there's all different ones. There's ones to look at bark flower remedy, whether that's appropriate. One of them we call is goal setting, but that looks at addressing the emotional issue and being able to move on. So there's lots of different, it's a whole range of things that we use. But at least that gives you an idea of the flavour of kinesiology.
It does indeed.
And it is really fascinating because people who don't believe in it, who I do it on, are then amazed at how I'm able to activate and do things. So yeah, it is very, very good. And I do recommend people look at kinesiology because I do think it could tell you an awful lot about your body. And also it's a way of us listening to our body. If we're in pain, there's a reason why. We're never in pain just for the sake of pain. The body's trying to protect ourselves, so we need to know why. So yes, so that is kind of what I will do in my diagnosis. And then my treatment. So I've listed a whole range of treatments, but I think for us, in terms of particularly for podiatry, it's the signposting we're really, really good at. So we're really good at giving patients information about stuff we read, our life experiences. So say, for example, the patient is the breast cancer patient coming in your clinic, getting quite depressed, they're on particular therapies, there's foot issues going on, they've got nail conditions happening. Who do you signpost them to? Who do you signpost them for support? It might be to particular charities like Macmillan, it might be Mind if it's bereavement, signposting them if there's particular focus groups that you might know in your local area that might be helping. I know at the moment during COVID, but sometimes there's like local community church groups that, or like, you know, groups at the library that you see that are, you know, for particular medical conditions that are going on. So it's always important that we can signpost them. It might be to colleagues that you know that are really good at their field. It might be that they need some hypnotherapy or counselling. So, you know, we're really lucky in the profession we are that we meet a variety of different therapists and we get to know them. So I think it's really important that we are able to signpost and use ourselves as a source of knowledge. We are fantastic. I've said again, you know, we get 20 to 30 minutes with our patient. We're fantastic at listening to our patients and understanding them. And we can really get, I mean, I get to know my patients really, really well. And you talk to them about a range of topics. So you do really get a feel of what they're like and what, if something's not quite right with them. So listening, I always think, is an underrated skill that we should all do far more of. I obviously use the kinesiology. I also do quite a lot with nutrition. And so in terms of nutrition, everyone thinks about supplements. And supplements are great, don't get me wrong, but you shouldn't be on a supplement the whole time, entire time in your life. And also, you know, by being on a particular supplement for ages could also create deficiencies in other nutritions that you're meant to be having. So I tend to go down the diet route. And a particular close colleague of mine who does fantastic work is someone called Dr. Stacey. She's a musculoskeletal sports medicine doctor, but she specialises in MSK problems related with gut health. So if anyone wants to read more about her, her website is www.dressie, so doctor as in the full word, and then SEESE.com. And she has a whole range of free webinars that you can listen to about gut health and nutrition. But I do find with my MSK patients particularly, there is an underlying nutritional issue goes on. So I do put them on certain probiotics. I do use my kinesiology to check which probiotic if they need to go on, but I also do it through foods. So I might be recommending particular fermented foods for them to help improve their gut biome. That will give them the nutrients that they need to strip from the foods, because you've got better good bacteria in your and fungi in your gut that will help. But also it can help things with like brain fog, concentration. It's a really fascinating field of how we talk about the gut-brain axis and how it affects mental health issues as well. So I always see nutrition and I suppose gut issues on parallel with each other when I'm treating. So I use a lot of nutritional work, and in kinesiology you are trained in nutrition as well, so that helps as well. Bark remedies, like I said before, you know, you've got a patient who's going through a stress point, whether it's bereavement, treatments, what it could be, you could easily offer them rescue remedy. And in rescue remedy, one of the bark flowers that they use is Star of Bethlehem. Star of Bethlehem is really good for traumatic situations. And I mean traumatic situations like, for example, I had to use it when I had to homeschool my children last year. That was incredibly traumatic for all of us, I think. I think they're still emotionally scarred by me, being military mum. And so using the bark remedy was able just to give me that little bit of a calmness that when I thought the world was going to end and that I was never going to be the loved mum ever, that really helped. But, you know, Star of Bethlehem, another one I use for patients like if they had a car accident is Mimulus. It's for fear. And the rescue remedy actually has, the stress rescue remedy actually has 5 different bark flowers in there. So that gives you an idea of a couple of the bark flowers that would work. For worry, another one that's really useful is white chestnut. And that's really good for worry and anxiety. And so it has a mixture, but that's where I would use my bark remedies. I would also use it in terms of doing some goal setting with the patient and talking them through it. Muscle treatment, so the fascial release, I use laser, I do acupuncture. So, you know, use what's in your toolkit. If you're trained in reflexology, you can absolutely use reflexology for particular pain points that the patient's experiencing. The adrenal glands are often flaring up, but they actually sit right under the arch of the foot. And often, you know, patients who've got plantar fasciitis, that they also may have heightened stress and anxiety going on, rubbing those points is actually also stimulating the adrenal glands and getting them to calm down. So that gives you an idea in podiatry where you could use something like that, you know, just doing a good foot rub. You know, we all enjoy having our feet rubbed when we're, you know, it's like often patients go to me, oh, I wish I could do that for ages. Can I take you home? I would love that, because then I wouldn't have to be homeschooling sometimes. But, you know, it's always, it's nice to hear, you know, we all like a good massage, isn't it? And also the other thing with massages, it's that touch. You know, at the moment, particularly during COVID, I think people really struggle that they're not being touched. We don't talk about we're not being touched, or having a hug. How many people miss having a hug? You know, you're probably one of the very few practitioners that are able to touch that patient and actually give them some calming relief by just massaging their feet. You'll be stimulating all those organs, those muscles and everything as well. So just it sends back a positive feedback to the brain of calming those nerve sensations down. Obviously using biomechanics and our training biomechanics and insoles if I need to, and the anatomy and motion that I've talked about, and acupuncture. But use what's in your tool set. You know, you've got a massive toolkit. Often sometimes podiatrists it's second profession. Use what you've got from your previous experiences, whether it's in whatever discipline you were in before. Use all your experiences to help treat those patients. So in terms of what I would summarize with it all is, look always beyond the feet. Always, always, always look beyond the feet. Always consider why there might be a physical cause. If something's not healing or the pain's unexplained, look at whether there's an emotional issue, nutritional issues. Look at that whole holistic approach and always treat the patient as a whole rather than just looking in isolation for things. You know, when providing treatment, address emotional issues if they're ready, mental health issues, gut issues, but also looking at that physical health, and make it simple and make it easy and make it accessible. I never bombard my patients with lots and lots of information. I probably, when you come and see me, I'll do lots and lots of things on you, but I'll probably only give you 2 things to take away to do. It might be as simple as introduce a new food to your diet, a fermented food, just that might be as simple as that, or do some breathing exercises, or take the bark remedy. I won't give them lots and lots of things, because if you tell the patient lots and lots of things, they'll go great at the end of the session, and then they'll walk out your clinic 10 minutes later, go, well, what was it I need to do? And then they might start with all good intentions, and we know it, you know, like a New Year's Eve, you know, New Year's diets that we do and things, you start for 2 weeks and then you forget. So whereas if you just give them one thing, they're probably more likely to carry on with it. And so I think that's always really important to do. I never bombard lots and lots of exercises or you know, lots of things they have to do. I just give them one final thing, you know, one thing each time, and then they go away and practice that and hone in on their skills. And what I also say to my patients is, I'm giving you the library to keep treating yourself, because as much as I love my patients, I always joke with them and I say, I love treating you, but I don't want to see you very often. So I always give them the tools that they can then carry on. And I think that's what practitioners, we all, whenever we go and see anyone, we want tools to help make ourselves better. And I think that's really important. So those are my summaries. I'm now going to do a practical thing that I thought we could all do together. I'm going to show you an NLP technique to do with just calming. Okay, so this technique is known as anchoring. And what you can use it for any situation. So say it's your patient who's finding it a stressful time being at home or being at work, or like me doing a presentation on Zoom. So any of those. What I'm going to get you guys to do is I'm going to get you all to close your eyes, and you're going to think of a happy, calm time in your life, whether it was walking along a beach, you know, feeling the wind in your hair, seeing a loved one, playing a game with your kids, you know. So I want you guys to close your eyes and think of that feeling. And I really want you to feel that emotion. Can you feel it filling up into your heart, into your chest, into your stomach? Really, that warm, loving, calm feeling, just totally engulfing your body. Okay, I'm now keeping that emotion in there, that nice, warm, happy feeling. I want you to touch your thumb to your index finger. So you're just going to pinch it very gently, your thumb to your index finger. And just keep that nice emotion in there, that nice, warm, happy feeling, for me, it's walking along the beach and feeling the sand under my feet, really feel that full sensation, you know, hearing those waves lapping down on the shore. Right, you're going to release that motion, that finger, and open your eyes. Okay, we're going to now do it again. You're going to feel that emotion again, and you're going to press those fingers again. Okay, and get that to all fill and encompass in. So you're going to press those 2 finger points again, and you're going to feel that warmth, calming, relaxing sensation going on. Okay, you're going to release it now again, and you're going to do it one more time. So again, you're going to pinch the 2 fingers together and feel that warm, calming sensation back at filling your whole body up. Okay, and open your eyes. I'm now going to get you to think of a stressful position, point, whether it's you're thinking about homeschooling tomorrow or going to a clinic or a particular stressful situation. And then I want you to press these 2 fingers together again, and you should feel this warm, calming sensation come back into your body. And it's your brain rebooting, doing a neurological reboot and getting that calm sensation back down. So think of whatever stress situation you're in, and then just press your 2 fingers together. And you should feel that nice warm sensation, and that stress kind of melts away, and it's not quite as what's the word, angry or in your face as it was before. How did you all find that? But you could give that to any of your patients, kind of thing, you know, if they're going through particularly, they're crying in your clinic, whether they're going through a bereavement, and it really does work for small situations. That's just a small NLP technique that you could use called anchoring, that really works really well at small, you know, stressful points in your life. Okay, right, any questions? And
could I just come in there very briefly, please, Afni?
Yeah.
And it's in response to a where are we? I'm just looking down the chat box.
Yeah.
And it says it's from Sarah. Thank you, Sarah. It's is it safe to recommend herbal products to our patients as we're not qualified in any side effects, contraindications with their medications? Now, you can see that Beverly Wright, who is also, as I say, she's one of our board.
Yeah.
She's the vice chair of education, and she's very much, and she lectures on alternative therapies as well. And Bev has put an answer in there, and I think I'd just like to put something on top of that, and then invite your answer as well, obviously, because you're. But I'd like to perhaps just make a suggestion from the medico-legal point of view, wearing my medico-legal hat, if you like. And the point that Bev is making is that the things you're talking about, the Beish, the Bach flower remedies, they are available over the counter.
Yes.
Now, when we're dealing with stuff that is available over the counter, if somebody bought some Bach flower remedy and then dropped dead, and I had to perhaps make a commentary report upon it, I would suggest to the barrister that they ask the person who made the suggestion that they should take this remedy, whether they were familiar with what they were suggesting. And I think we could define familiarity as everything that's sold, every kind of medication, be it prescription only medication, over the counter medication, controlled drugs, whatever, it all has something called a summary of product characteristics, which is part of its licensing process. The question that would be asked if that practitioner who recommended it was standing in the witness box would be, are you familiar with the characteristics of this substance? And if that person then turned around and said, yes, I'm familiar with the summary of product characteristics of this over-the-counter medication, then I think any case that was put against them would completely collapse. because it is not something that needs prescribing. It can be sold openly to the public from a supermarket shelf, for example.
So I agree with you, Martin. So in terms of bark remedy, I wouldn't be recommending, unless you're trained in bark flower remedies, to recommend specific flower essences. I'll try to give you an example, because I'm trained in bark remedies, what flower essences I've used in my clinic, and give you some of the flower essences that are used in the rescue remedy. So what you could prescribe in those cases where I would, because like I said, I use the bark remedy in conjunction with my kinesiology. So I use it together, and I'm trained in that nutrition and bark remedy side of things. What you can just, so say you have got a patient with you, you could say, have you heard of the rescue remedy for stress? You know, they can then, you can say, do your research to them if you want. Also get them to read the product to make sure that there's nothing contraindicative. And also, you could also say, if you are regularly recommending the bark rescue remedy, you yourself can also see what the product summary is and then be able to advise properly. But I don't give my patients, so for example, if we're doing, let's say we are doing nutrition, I don't just give out nutritional supplements. And I said to you, all of you, when I'm looking at nutrition, I'm not looking at supplements, I'm looking at dietary stuff going on. What is deficient? Why is it deficient? What foods can you put in your diet? So things like, for vitamin D, eating mushrooms are high in vitamin D. For something like vitamin C, which is a strong antioxidant, eating parsley, because that's actually has much more vitamin C than oranges. Also, sweet peppers have a higher rate of vitamin C than an orange. So it's nutritional in terms of food, which I think we can all give advice on, that you should hope patients wouldn't, you know, die of unless they've got an anaphylactic shock or allergies to. But you have to know your patient, and this is why I'm saying a good patient history is always important, and making sure you're listening to your patient and finding out exactly what's wrong. But yeah, absolutely, if you're recommending something that's sold over the counter at Boots, they've got product summaries that you can always tell the patient, please read the product summary before you buy it. You know, that could be your disclaimer before you do it. You know, I've heard that this is good, it might help you, have a look and research. And I'm always it's very, very important when patients come and see me that I also tell them that I'm here to empower you to get better. You know, I don't have all the answers. I'm here to help you, guide you to get the right answers for you. But it's very, very important that you take some responsibility for your own health. And I think in this COVID situation, I think we really do have to be, you know, if you've got diabetes and things, you do need to be responsible for your own health. It's part of what you have to do, controlling your health, making sure you're exercising regularly. But, you know, we can take you so far, but some of it is on the patient's journey. So like I was saying, when I give them a particular exercise or a particular treatment to do, or a particular emotional therapy to use, I give them one thing, but I say the onus is on, I expect you to be doing that to be able to get you to that next treatment point.
Sounds to me as though perhaps a session on the base flower remedies would be perhaps useful.
I will try. I'm not as good as I think other people probably on the bark remedies, because I use it very much heavily through the kinesiology route. But you know, it's a fascinating. I mean, there's loads of literature on bark remedies and the bush remedies, and bark. Also, the bark remedies, you can actually do courses on it outside of this, and they give you a really good course, and they're really, really, really well structured as well. And yeah, but happy to do a kind of, because there are 38 different remedies, and the way he found it was actually the practitioner was looking at how different flower essences, and he'd mapped out how different emotions were affecting the different flower remedies and testing it out on himself. And then they came to, you know, these 38 different flower essences, and, you know, being extracted from different flowers and things, and how it came to about. But there's a whole range. There's bush flower remedies from Australia, there's ones from Brazil, you know, so it's really interesting. You know, plants hold a lot of key to a lot of conditions that you could probably treat, so it's really interesting.
It's a fascinating area. Years ago, I heard of something called the marigold remedy. I haven't
Yeah.
heard of that recently. Are you familiar with what that is?
Yeah, so marigold's used more in homeopathic remedies. Marigold's actually used that. So marigold therapy was particularly for the homeopathic school of podiatry. I think I've forgotten his name, Dr. Khan. And they used to use it for a whole range of conditions, for inflammation. They used to use it for verruca treatments, a whole range of things. They used to use it as a paste form as well. They used to use it for musculoskeletal problems like plantar fasciitis as well. But recently it's gone out of favour, and I don't know whether he's still running the courses, because in order to get hold of marigold paste, the therapy, you have to have done his course and then be certified to be able to use it. And I think there was some conflict about, you know, whether using alternative medicine and how it sits in the role of our medical field of podiatry. So, but I mean, I still hear lots of people recommending marigold therapy and having fantastic success rates with it. I personally haven't been trained in the marigold therapy, but I have heard that people have had really good success stories with it.
Yeah, I read about it years ago. I don't know much beyond it. But it fascinates me, though, the kind of emotions that anything that is less than traditional can engender in people. I mean, I've had some conversations with colleagues who become absolutely incensed if you dare to mention the word homeopathy, for example. I mean, obviously, as an independent prescriber, I can reach for a drug. I can give them all sorts of obscure drugs and make them, you know, completely gaga if I want to. But having said that, I will very often try and find something that's a little less dangerous than giving them a course of Valium. And it's surprising how many alternatives there are if you approach them with an open mind. So, and I'm always ready to do that. And I'm always surprised at how some parts of all the medical professions are absolutely and totally opposed to things that they didn't hear in mainstream medicine. They just seem to, it's like rubbing a dog up the wrong way, almost.
Yeah, I know, I completely agree with you, Martin. So I practice a field known as functional medicine. So functional medicine actually looks at root causes, and they view general medicine as sticking plasters. So say you've got pain, you give it some pills, you get some other symptoms, you give it some more pills. Whereas functional medicine looks at why am I getting this? Why is this happening to me? What's going on? And it looks at the body as a whole and starts piecing together that. There is a Society of Functional Medicine that you can join as well, which is, but it seems to be, I mean, from the field that I work in, that functional medicine is becoming much more of a growing trend, because I think people are getting a bit more disillusioned to general medicine. You know, not everyone wants to take a pill, and not for the rest of their life either. You know, people want to find answers. So one of the techniques I gave you, the NLP, you know, works really well for patients on long-term depression or ME and things, because it changes the way the brain is processing, you know, the kinesiology. Like I said, you know, I've had patients who've had massive emotional traumas to their lives and things that the kinesiology has completely changed and opened it up. And I suppose because it changes the way you're looking at things, you might be that person that's looking at things, everything's the glass is always half empty, whereas then suddenly you're thinking of things, oh my god, the glass is half full. It changes your narrative and the way you do things. You know, you start to look at more positives. If you start to look at more positives, you then notice more positives coming into your life as well. So I do think changing the way the brain operates is really important. But I do think so personal experience, I have severe anaphylaxis to wheat. And I'll give you my example of why I went into kinesiology. So I was 10 years old and I was having anaphylaxis every day. So much so I knew the A&E team on a first name basis, because I was reacting to everything. No one could figure out what it was. I'd gone down the whole general medicine route. You know, we'd had well specialists at St Mary's Hospital looking at me going, no, don't know why you're getting all these multiple allergies. I, by chance, was very lucky. I met a fantastic kinesiologist and found out I was allergic to wheat. And one of the things that's really shocking is in general medicine at the time, you could only ever be allergic to peanuts. I was allergic to wheat. They put you on a diet of basically bread and water. So you can imagine I was killing my body every day, because I'd eat bread, I'd have the anaphylactic shock. They'd pump me full of steroids. I'd be fine. As soon as the steroids wear away, the anaphylaxis would come back and I'd be eating bread again. And you could see this vicious cycle happening. And we went back to the doctors and said, you know, we found out that I'm allergic, and I'd used systematic kinesiology. Remember, systematic kinesiology is even less known then, you know, 30 years ago to what it is now. Went to them, no, you can't be allergic to wheat. I cut out wheat, cut out rye and cut out barley because they found out that's what I was allergic to from the kinesiology. And from then, didn't have allergic reactions. I obviously still get anaphylaxis if I've had something contaminated. But even now, when they've retested me, you know, doctors have done, you know, I've gone back into general medicine because I had an antibiotic allergy. And like, no, you can't be allergic to wheat. Try to insist on me that they should be doing me ingesting that wheat and seeing what happens, because they thought it was psychological. And it wasn't, because I refused. They did a skin prick test and of 0.4 milligrams of wheat on my system, and I had full anaphylaxis to it. So that is one of this is why it might not be to everyone's taste, and I agree, but it works, and there is many studies on it working, systematic kinesiology. It was developed by a doctor and chiropractor and osteopath and acupuncturist. You know, Eastern medicine also has a role. You know, it's been going on for thousands of years. We know with meridians, there are studies that they put radioisotope isotopes into the body, and they've actually passed up the meridian points and acupressure points and where the alarm points are in the body, and they can track which meridian it's working on. So there are studies out there. I think the problem is medicine's kind of closed off sometimes with certain people, and I think for me, that's not how I practice. I practice all about making sure I can do the best of my ability for my patients and give them the most amount of information that they need. And that's what any role of any practitioner is. We do no harm. And the only way you can do no harm is if you're not sure, you say, I'm not sure, try this, look it up.
Mm. I do think it's an area that we as a profession should be looking at much more.
I think so too. And we're really well placed. Like I've said, we have such amazing knowledge in terms of, we know about skin, we know about nails, we know about nerves, we know about circulation, we know about muscles, we know about the gait analysis, we know about how the body moves. I don't know which other profession you could say knows all of that as well.
Well, indeed. And of course, in your particular interest with cancer, we know about skin. I mean, it's the largest organ in the body. And yet, I know when I was doing my skin surgery training, I spent a day a week for a year with a consultant dermatologist in our local hospital.
Yeah.
And we actually had we used to run a book between us, the dermatologist and myself, as to how many verrucas we would see during the course of that day that had been referred by a general medical practitioner as a skin cancer.
Yeah. Yeah. And I mean, you know, we hear about it all the time, you know, verrucas being misdiagnosed constantly. But also, I mean, one of the examples is, so when I was writing up my articles, while we take it for granted things like ingrown toenails, one of the side effects of particular cancer therapies like cytarabine and taxanes are people get these suddenly involuted nails because it affects fast growing cells, but also get this onycholysis, which is the lifting of the nail, and an ingrown toenail. And the amount of dermatology papers on ingrown toenails was unbelievable. But why did no one at any point refer to a podiatrist who would have cut the nail properly, treated the area, possibly done a nail surgery if needed, and sorted it? So, but the amount of what should we, and this, I suppose this is going back to the example of general medicine, sticking a plaster on it. The amount that we're saying, oh, well, you should use, you know, an antibiotic, give them an antibiotic and it will resolve, or give them this antibiotic and it will resolve, or put them in antibiotic cream and it will resolve. But no one at any point has said, well, just cut back the nail and clear the area out, you know, or use iodine and do a nail pack. So things that we take for granted are going into dermatology clinics, and dermatologists not having a clue what to do with it. So I think we have a really untapped market, honestly, in our role in cancer therapies.
Well, of course, I mean, that's the job now of bright young things like you. You've got to spread the message. you know.
Well, hopefully all of you will enjoy my next 2 articles, which will be running in the consecutive podiatry review. They are slightly lengthy, so I apologise to anyone who's having to read my articles, because they are. But hopefully I tailored the articles that even if you didn't have any knowledge, you could take away something from there and use that in your clinic the next day. So any knowledge from the article and be able to use it straight away in your clinic. And that's how I've tailored everything that I do, because I just think it's important to educate and spread the word about what we do.
I couldn't agree more. And if anybody is listening and they don't subscribe to Podiatry Review, obviously, if you're a member of the Institute, you get it as part of your membership. But if you're not a member of the Institute, and why not? But if you're not, then you can subscribe to it as a subscriber. I mean, certain students get free copies in certain circumstances if they're on certain recognized courses. But subscribe to it. There's a huge amount of information in every issue. And now we've got hold of Afni. Believe me, we are actually going to wring her dry. So there will be article after article from Afni.
I think David Tollerfield, poor things, also tried to wring me dry too.
Well, I was looking at the last one, and the where your article was in it, there was also an article from Dave Tollerfield as well. You know, fascinating. It's a really good, fascinating read. Well, you know,
oh, I'm glad. And also the back page, and particularly for all of you looking at this issue, the back page is really important. It's basically, I've tried to make a summary of different conditions and what you might see in your podiatry. The other page, just before telling you all about me, it's like an appendix of different conditions and what those lumps and bumps might be in your clinic. So I try to make it, because obviously, there we go, fab, yeah, and then there you go. And if you turn the page over again, Martin, there's an appendix, and it's got all different cancer lumps and bumps as well, and what they could be. So hopefully that will also help, and you could keep that in your clinic, that you might not be sure, open it up and go, any of that looks familiar to you. You know, I've put some classifications of how to look at moles or skin pigmentation, and also what other possible nail things you might be seeing, you know, deficiencies and stuff. So I've tried to make it that it's not just that we're looking at cancer. We always know that at the back of mind, if something looks different, don't be scared to question it. And also, I think that's what I do in my pain clinic. I question everything. Why are you getting it? What is going on? What have you seen? Why has that not worked? And those are really key things. And it's just always why. I suppose hopefully you've kind of got a sense of what I'm like as a person. I don't sit still. I'm always trying to figure out what's going on and why.
And I think that's a very, very good point to make as a closing remark, because I notice we're actually running over now.
Oh, God, I'm so sorry.
No, when we first started talking this evening, when we first logged on before we went public, I said to Afni, I'm sure we'll run out of time. She said, no, we won't run out of time. I said, yes, you will. We always do when we have somebody on who's interesting. And to be fair, most of the people we have are interesting, certainly including you, Afni. We invariably run out of time. Well, I would like to thank you enormously for coming to talk to us.
Thank you so much for having me. And I just want to say, can I have a couple of special thanks to people that helped me get to where I am?
Of course,
particularly David Tollerfield, because he just spoke to me. It was a conference 3 years ago. He spoke to me and he saw the work I was doing. And I was explaining to him that I've had some real struggles with trying to expose how podiatry should be helping with cancer. And he really encouraged me and really told me to persevere. Writing the articles about cancer. So I first did a reflective blog for him on his website and things, but it has been a labour of love. I don't think poor David realised that when he asked me to do something, it ended up being over 10,000 words. It was like a mini dissertation had come out, which is why he said you need to explore it more, and recommended that you guys should speak to me. But I also want to, I don't think people realise, but a particular special mentor of mine, Dr. Suzette Woodward and Dr. Essie, have both mentored me in a number of different ways in terms of what to look for, how to deal with things, because I also do a lot of policy work for particularly Dr. Woodward. And I just think it's really important. It doesn't matter whether you're a private practitioner, NHS, you can always make a change. And I just want to say special thanks to both of them, and also to yourselves for being so supportive and encouraging me to carry on and tell you all about what I do. So yeah, really appreciate it.
That's a lovely set of lovely set of acknowledgements you've given there. We are what we're made, aren't we, as we journey
Oh,
through
completely. You know, there's so many people that I'm very, very lucky that I have got to meet some amazing people in cutting edge in the field that they do. I mean, Gary Ward is another one that I know very well. He was actually on BBC Doctor in the House with Dr. Chatterjee. You know, I'm very, very, very lucky with the people who have taken the time to help allow me to understand and shadow them and work with them.
Well, you know, now that's an interesting thing. With all the names that you've mentioned there, you've now given us another hit list. You realise? I mean, especially this year, of course, because we've still got COVID. We're doing what the Canadians showed us how to do last year with a virtual conference, because I was due to go and speak to their conference last year, the Canadian podiatrists, but they had to put it off. So they put up a virtual conference instead. And it was so impressive that in the Institute this year, where we normally have a physical conference, we're going to have a virtual conference as well. So I hope, Kirsty, in the background there, you're scribbling these names down so that we can contact all these people and say, Afni told us to contact you.
I think some of them may kill me, but that's fine.
Well, on that note, I think you're quite safe. We haven't killed anybody in the Institute since about 1938.
You're fine. No, it just they are. I have to say, I'm very, very lucky that they've all spared their time, because all of them, you know, they do such amazing work, and their time is. I know their time is precious. So when they give me any time, I really appreciate it. And I think that's it. It's just for anyone who wants to work in any of the fields that I do, is research, 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 and talk to as many people, shadow as many people as you can.
That's very good advice. And on that note, my concluding thanks to you very much. Until the next time.
Yep.
I look forward to seeing you, and thank you to everybody for attending as well. Don't forget to claim your CPD certificates if you've attended for more than 95% of the time. And also, of course, don't forget to watch the next one as well. So look forward to seeing you all again. And thank you again, Afni. And good night to you.
All right, take care.